This is a mini lecture for the neck or our cervical spine. Our neck and cervical spine is made up of 7 different vertebrae and allows us to carry our head on top. So the musculature and structure of the neck, starting from the outside, we have a very long and thin, what we call the platysma muscle, and then scalene muscles. Now, these muscles are the first ones that you can see when you do that. Okay, so that allows for the connection of the head to the first and second rib cage bones. So we have like a neck brace. We then have deeper muscles which control the micro movements and position that our head turns in. And then from that, we will then, of course, have all the branching nerve endings which come out of the vertebrae especially in towards our head and then in towards our rib cage area, which will control our heart and our breathing, and our blood pressure, and so forth. So while those structures allow us to have the head sitting nicely on top and to have micro movements, and of course we also have the ability to control certain nervous system input from the cervical spine, the issues come when we have certain incorrect postures. So if we sit at the computer all day and we have these rounded shoulders, well, that will start to draw our head forward, and then the more we leave it there, well, the worse it will become. As the head moves forward, it places more and more strain onto the muscles at the back of the neck. It can also shorten and inhibit our larynx coming down here, which is an important aspect of our breathing. Additionally, it's an important aspect of how our mouth works. If we push our tongue to the roof of the mouth and we look into the mirror, we can see the movement of our larynx and what we call the hyoid muscles and bones through here. If these become in dysfunction, then we lose the ability for our tongue and our chewing or biting mechanisms. This can lead to jaw pain and additionally increase even further the position of our head forward, which then in turn places yet again more pressure onto our posterior or backside of our neck. So common movements to increase our neck function is to pull our chin back, make small rotations, look up to the sky, look down to the ground, so we can feel how the posterior or back of the neck muscles are working. I hope this has clarified a little bit about how the neck works and how important, although even so small, these muscles are. Thank you.